At Health Check 10 now, it's a topic many folks don't like to talk about, dying.
But there are organizations that are around to help the patient and families go through the transition. Health Check 10 reporter Barbara Morse Silva reports.
Kate and Michael Green met in college in D.C., married, settled down in Mansfield, Massachusetts, and had 2 boys, Owen and Liam. Life was good. Then about a month after Michael, who was a lieutenant colonel in the Army National Guard, came back from a tour of duty in Afghanistan a couple of years ago, Kate noticed a mole on the back of his leg. He got it checked.
And 2 weeks later, on his way home from work, he got a call basically saying he has melanoma.
Despite many months of treatments, his cancer eventually spread, and by January of last year, Kate reluctantly sought out hospice care for her husband of 18 years.
Truly, hospice to us meant that he was dying.
Sometimes I'll speak with a patient and they'll say, well, I don't need hospice. And I'll say, you're right, but your family does.
And Kate, her 2 boys, and husband were all beneficiaries of the care they received through Home and Hospice Care of Rhode Island, first in their home, and then when he was transferred to Home and Hospice Care of Rhode Island's inpatient center in Providence.
For my kids, it was a safety place.
Pleasant surroundings, not a lot of tubes and machinery that might be disturbing to a kid.
He still had the pain medication, but it was on his hip, so they didn't really see it. And just in terms of the social worker and family dynamics, they were all very helpful, and especially when it was getting towards the end.
On February 10th, 2013,
the nurse sat with me, and while my husband basically was dying, he was taking his last breaths, and she sat with me the whole entire time.
It's been more than a year since Michael's death, but Kate still walks through these doors once a week to meet with Deanna Upchurch, a bereavement counselor here.
Hi, Kate. How are you? How are you? Good. Good to see you today.
Many family members like Kate become like family here, taking part in free counseling and group sessions months, even years after the death of a loved one. Problem is, many folks don't get in touch with hospice soon enough.
People are eligible for hospice when they have a 6-month life expectancy.
Dr. Ed Martin, the medical director here, says the earlier the better.
Actually, some studies have shown that people live longer with hospice care than those who didn't get hospice care before they died.
All of the bereavement programs offered by Home and Hospice Care of Rhode Island are free of charge to families. There's even a summer camp for kids who've lost a loved one. But they rely on donations and fundraisers, and there's a fun one coming up. Mario and I will be there. It's a take on the Studio 54 days, so you can wear those platforms and other 70s attire if you'd like. For more on this fundraiser and Home and Hospice Care of Rhode Island, you can log on to turnto10.com and click on Health. And that's Health Check. Barbara Morse Silva, NBC 10 News.